I thought I'd give you a brief update about where we are with the vaccine distribution, and then very happy to answer your questions as we go through this. Throughout this pandemic, there's been no playbook. Our decisions each day reflect the best information available at the time. We've had to be both adaptable and agile to best serve our communities. And this is really a journey of that agility. There's so many lessons learned regarding COVID-19, but also this distribution of the vaccine. And I do believe that agility and the relationships and the trust are the center of everything we have done in this past year, and that we'll continue to do as we battle COVID-19. We are very focused on building a culture of trust through collaboration and transparent communications. This dashboard is one of those examples of that transparent communication. And we also recognize that trust is something we can't take for granted. This trust and the relationships that we've cultivated are critical to help us solve the problems that we're faced today. These complex issues of an effective and a successful vaccine rollout for our community. And we are really focused on how do we help all communities feel comfortable with taking the vaccine. So just to give you some numbers and some context, and then I'll comment on this dashboard here. So far, there's been 224 million people in the US have had COVID-19, and 400,000 people have died. We know that the numbers are much higher worldwide. 14 million in the US have received their first dose of the vaccine, and just under 500,000 in Michigan have been vaccinated with that first dose. We at Spectrum Health have mobilized a massive immunization effort as quickly as the supplies and the state guidelines have allowed us. And to date, you can see on this chart here that we've provided about 35,000 vaccines thus far to our communities. We also use this dashboard to get a sense for where we are with COVID-19. So you can see on the top left, it says that we have 169 people within our hospitals that have COVID. This is a much better number than it was at Thanksgiving. We were around 400 at that time, but it seems to have plateaued where we haven't gone too farther down. I am pleased to see that the percent positivity in the far right corner at 8.9% is below 10%. I'd love to get that closer to 3%, which is where we were this summer. But again, we're going on the right track. And so this is just critically important, especially as we know the new variant is in the state of Michigan. So today I wanted to talk about the vaccine. We were one of the first health systems in Michigan selected to store and distribute the Pfizer vaccine because we bought 3 freezers back in September. And when everyone probably needed those freezers, they were a hot commodity to purchase. These freezers look like any other freezer, but they do have special equipment, so you can't open them for 2 hours once you first open them, because it really does need to maintain that very, very cold storage. The vaccines, we've heard a lot about this new process, this mRNA process. It hasn't been used for humans before, but it's been developed over decades, and it's truly revolutionary as a platform vaccines. 2 things. I think it's amazing that we have a vaccine in less than 12 months of identifying COVID-19. It's also amazing that the effectiveness of both the Pfizer and the Moderna is right around 95%, which is pretty substantial and significant. So the Pfizer and the Moderna are very good vaccines. You can see here the requirements that are listed there with the very cold storage and the 2 doses. And those 2 components, as well as the mixing for Pfizer, is the downside to those, because it just doesn't allow for that scalability. Other vaccines that are likely to come out that haven't been approved yet won't have as much of this cold storage needed, and some of them will only be 1 dose. So that scalability and the ability to reach to other remote areas will be much easier to do. And so when I think about the vaccine strategy, all the vaccines will be great. All of them have to be over 50% effective. All of them have been tested in the clinical trials when they become approved. I think there'll be various vaccines for particular places, just to make sure that it's easy to get to the whole population as we go forward. There's a number of ways that we are working to get the vaccine distributed, to get it in arms. You know, I remember watching the news back in December and the Pfizer trucks leaving Kalamazoo as they were going to the distribution. A fun fact, you know, Kalamazoo is really close to Grand Rapids, but it was interesting that we got our, I can't remember if it was FedEx or UPS note that we get our Pfizer from Louisville. So it went all the way to Louisville, then flew all the way back to us. It's just something unique. So what we're seeing is that last mile of distribution is critical. On the left side of the screen, those are the populations that currently are allowed or eligible per the state of Michigan to receive the vaccine. 65 plus, healthcare workers, law enforcement, school and childcare. When I've talked to the state, their goal is get the shots in people's arms. That's what we want to do. And I think it's wonderful that we've actually opened up to the age 65 plus. Many of the states and many of the countries that have really moved forward with their vaccination process have had as little restrictions as possible, still trying to make sure we get to those that are most vulnerable. On the right are ways to actually schedule the vaccine appointment. So for us, we can schedule it through calling. We can schedule it through our MyChart. Epic is our electronic medical record, and so you can create a MyChart account. You don't have to be a patient of ours. Or we are also creating a chat bot that will just easily sit on top of our website, and you don't have to create a MyChart account to access that. What happens is you go into one of these and you say, I'd like to get the vaccine. You fill out the vaccine questionnaire, and then we put you in a queue. And when you're eligible based on the eligibility determined by the state and when supplies allowed, then we will send you a notice to say, let's schedule an appointment. The scheduling of appointments is really important because we want to make sure that, one, we have vaccine for you, but then we also don't waste any vaccine by people not coming. So that's why we're almost every place is scheduling appointments instead of waiting in line for it. We're continuing to move forward with vaccinating our communities using a two-pronged approach. The first one is large scale on the left, and we're working to provide easy, accessible, flexible space where we can do 2,500 plus people per day. Depending on how many people we have there, we can do 20 people per hour per inoculator in these mass sites. And the sites have to have parking, space for observation that is socially distanced. We also have to have basic things such as connectivity and bathrooms and easy accessible parking, perhaps on a bus route. And so we know that those are only in certain places. On the flip side, we want to make sure we target the most vulnerable populations. And so we're setting up mobile clinics. For example, partnering with a church to provide 250 to 300 vaccinations on one day and coming back a month later to give them the second dose. So that's the process that we're doing, this two-prong approach. The biggest issue with any of this distribution is the availability of the vaccine and knowing ahead of time how much we will receive. To date, we only know how much we're getting for the next week. And I think it'd be a whole lot easier if we knew maybe a 2-month calendar about the supply of the vaccine. I expect that will come. We're early, but that would just be very helpful, especially as we know the demand is outpacing the supply right now. I also believe, and this is our guiding principle, our view, is that we're not going to schedule someone for a vaccine unless we absolutely know we have the vaccine. I don't want to give people false hope. I don't want to have to call and reschedule a bunch of people. So we're just making sure that we have that vaccine before we schedule people, which is why you may see sometimes where we say we're not scheduling anymore, because we're waiting to find out how much more vaccine we have. So that's part of the intricacy of the process. This shows the number of vaccines that we've administered and scheduled. So at the top, you can see 36,914. That's how many first doses we have administered and scheduled. We've actually done 32,000 administered, and we have about 5,000 that are scheduled for this week. The second number is the second dose that we have administered and scheduled. It's a far lower number, but that number is going to start increasing significantly as more of the population, either with Pfizer at 21 days or Moderna at 28 days, gets that second dose. And then you can see the map. We just serve mainly the west and southwest part of Michigan, but you can see that we're putting clinics throughout all of our sites to make sure we're connecting with our communities, as well as doing these mobile clinics as we go forward. This is information about the state. And because we've lessened the restrictions, we have been able to significantly increase the percent administered by state-driven distribution. So there's two ways to do the distribution. There's state-driven, which is vaccine given to hospitals and health departments to get out to the communities. And then there's the federal long-term care program, which Michigan contracted with Walgreens to administer the vaccine to people in long-term care settings. And so you can see the percent administered for state-driven distribution is now at 60%. I expect that percent inventory is still going to be somewhat high, again, because I don't want to schedule somebody if I don't know I have the vaccine, but the turnaround time of that schedule will be pretty quick. And then for the federal long-term care program, they have really ramped this up over the last 2 weeks. So they're starting to get much better at that in contacting the long-term care facilities and getting them their vaccine as they go forward. This shows you where Michigan ranks. And when I look across the whole country, Michigan is 17th, and we moved up from 32nd in just 1 week in terms of most doses given per 100,000. The states that were ahead of us are the smaller states, and several of those smaller states, such as West Virginia and North Dakota, they decided not to use the federal LTC program and actually administer the doses to the long-term care facilities through their state distribution. So that's why many of those are much higher right now. But when you compare it to the largest states, Michigan is number 2 in the country in vaccine distribution. We've actually increased quite significantly. And so we're doing a great job. I think that this is really just going to be limited by the vaccine availability. Many of the health systems, health departments, and now Meyer are gearing up to make sure we can vaccinate our communities. So the rate limiting step will be the vaccine availability. So how many people do we need to vaccinate? This talks about the strategy to vaccinate our population. Currently, on the left, none of the vaccines are approved for those under age 16. And I haven't heard of any trials, at least in Michigan, for the pediatric population right now. So when we think about the herd immunity, we have to account for the fact that 20% of our population is under age 16 and currently isn't eligible for the vaccine. And then we have to factor in this new variant, because we do know, although it's not more deadly, it is more transmissible. And the more people with COVID-19 could have more people at risk to come in the hospital, develop long hauler impact, and then potentially for death. So with a more transmissible virus, you can see on the right what we thought at first in terms of herd immunity for the current strain, and now what we think we need with this new variant. We need higher number of people getting the vaccine to achieve herd immunity. And to put it into greater perspective, on the left, we would need, and the current strain, we would need 60% of the population to get the vaccine. But if you take out that 20% population that's under age 16, we really need 75% of the adult population to get vaccinated. With the new strain, again, 73% of the whole population would need to get it. Take out the under age 16, it's 91% of the adult population to get the vaccine. That is huge. And I just thought I'd share this with you for comparison. The flu shot, which many of us have some built up immunity to, is around 50% for adults in Michigan. So there's a lot of work that we need to do to communicate the value and the benefit and understand the risks of this vaccine so that we can get our state and the rest of the world, country and the world to take this vaccine. This is big. This is a Herculean effort. It takes all of us to do this. We have really been focused on over communicating and over listening, partnering with communities to make sure that we're connecting about how do we get certain populations to take this vaccine so all of us can get to that herd immunity. We also realize that healthcare is complex. This is a complex problem, this last mile distribution. And so we are striving to make sure that it can be as easy and simple to do, and that we create more trust within the healthcare environment. We know that a one size fits all does not work. And so that's why we've created multiple ways to sign up for the vaccine, to schedule the vaccine, multiple ways to get the vaccine, large scale or mobile clinics and so on. We want to make sure that it is easier for our communities to get this vaccine. We are also very focused on the right way to distribute this. So we've engaged our ethics team and committee to help us ensure that we're getting the vaccine to those that are most vulnerable, and addressing health inequities and the specific concerns from populations regarding the vaccine and the concerns related to that. I am really pleased that we opened up the restrictions. Again, our goal is shots in arms. And we've found throughout this whole process that we have to move with agility. If we hold out for perfect, we won't move fast. And so we are going with good. We need to continuously improve and innovate. And again, like I said, partnering with everyone, because no one can do this on their own.
Let me ask, you really answered one of our questions, which was about herd immunity. That was something that we were really interested in. Can you tell us, going back to March, the way things were almost a year ago when the shutdown started happening, can you talk a little bit, how do you think Michigan is doing compared to other states in our response when you look at your peers nationally and the governors and everything that's been going on?
I think we've done very well. I'd say just an example of back in October and November, especially for our community, when we started to see the increase in COVID cases and the percent positivity, I'm so proud that everybody heeded those warnings and actually didn't gather. They changed their behavior, because we haven't seen an increase in cases since Thanksgiving or Christmas or New Year's. And so I think that's really positive. People care about each other and are doing it. I do think this is a serious issue. I think it's both things come together. We have to protect health and economics. And but I think we're doing many of the things that we need to do, and we'll need to continue to do social distancing and washing your hands and wearing a mask, even if you have the vaccine, until we get to that herd immunity.
Part of that, as a follow-up that came from the chat, was a question about more centralized approach. Do you think we would have been more or less successful if it would have come from the federal government?
That's a good question about centralized approach. I think that there's a benefit to both, because we had to really learn and innovate and improvise as we were caring with COVID-19 patients and as we're doing the vaccine. And so there's some sense where I think communication is critical, and having that two-way communication needs to go all the way. In some cases, we didn't have some of that. But I also think that if everything is so rigid, we wouldn't have the innovation and we wouldn't have the sharing of ideas that actually spread quite quickly to help every area actually be even better. And so I think you need to have a balance of both. I do think communication is critical, and having clear purpose and goal, like shots in arms, is the important thing to do. And how do we get that out? And then I say this often, but we have to. This is a hard process, and we're not going to please everybody. And so it's we have to have a little bit more trust in the process and how it's going to go there, and try to understand the reason why we're doing it instead of applying blame.
So can you talk a little bit about some of the more vulnerable populations? Because I think that there are communities of color that are resistant to getting vaccines. And is there any special, communication strategy that you've heard, and what's been going on to reach out to make sure that those folks are getting vaccinated?
Yes, so exactly right. We're very concerned about the people of color, and historically, healthcare and vaccine development has not been good for them. So we are doing a lot. We're partnering with members of the community to do PSAs, to reach out and have individual conversations. That's where we're going to put our mobile clinics to have those conversations about getting the vaccine. We have a number of our physicians and advanced practice providers who have welcomed the idea of talking to pastors and other members of the community to enable them to say, set the example and say, this is okay, and we've done this testing. There were people of color included in the clinical trials. I think that there could be more done regarding research, but we need to continue to work on this to develop that trust. We can't just assume that this will happen. It has to be through communication, it has to be through trust, and engaging with people on it. That's why we're so transparent about our information.
So there's several questions in the chat about more detail on the vaccine. So is it one and done? Do we need it next year? How is production ramping up for that? Those are all kinds of questions that are appearing. So can you talk a little bit more, I guess, in detail? People want to know more detail about it.
Yeah, so again, this is all new. We think that if you get both shots, and it's really important that you get both shots if it's a 2-dose regimen, that you should be good for a year. But they're going to continue to do studies on that to understand what that is. And so we think it's good for a year. I'm not sure if you're going to have to go back and get a booster every year. If it's going to be 1 or 2. That's still to be determined as we go forward. And our first effort is let's get everybody with the first shot process. In terms of manufacturing, I think that all of the manufacturers are trying to get as much vaccine as they can create. Some of them, again, took the risk and the chance before they got approval to start manufacturing. So they were ready to ship as soon as they got approval from the US, from the FDA. And so our authorization to move forward, not approval. And so I think they're taking that risk to get it out there. And the requirement that it is over 50% effective is critical. And I expect all of the vaccines to be higher than that. And so it's, again, you can't go wrong with which vaccine to get because it will provide you with that immunity.
So we are a leadership organization and networking organization. So one of the questions here is about any leadership lessons while you've been leading Spectrum Health. And my thoughts are also in relation to any disaster recovery, preparation that you had done prior to this happening. What kind of, if you can talk a little bit about that.
Yeah, there's so many leadership lessons learned going through this. So let me just go back to the pandemic exercises. We've done exercises before. We've had mass casualty drills and things like that. We had an H1N1 plan that we pulled out when COVID came, and it was quite different than what we needed. And so I think you have to be comfortable, you have to have a plan, but especially in a pandemic, it can't be set in stone. You have to pivot, you have to modify it, and you have to be okay with that. You have to be okay with being wrong and saying, yep, that's what we knew, and let's now pivot to, because we know more information. I think from a leadership perspective, it's critical to over communicate and over listen. We set up town halls every month, sometimes every week, to communicate to our team members, and also had that two-way communication so that they could ask questions and we could respond to that just like we're doing right now. I think the other is we as leaders need to be authentic. It's critically important that we create that trust with our teams, with our community, that we're sharing the information that we know to date as transparently as possible, but it could also evolve. And so being authentic is critical. And the last one that I have a number of them, but the last one I'll share is just as leaders, you have to think big and think small. So sometimes you have to use a telescope and sometimes you have to use a microscope. And it just depends on what's going on. But you have to make sure you're still thinking about what is the goal that we want to accomplish out here, and then make sure the details are coming together.
Mm-hmm. So what is the best way that we can help connect community groups with your vaccination strategy?
So we have a number of people that have connected already, And right now we're working through our West Michigan Vaccinate group, which is a combination of health departments and health systems and pharmacies to coordinate how do we reach out to various populations, because we all don't need to be just on everybody. We need to have a coordinated approach. Again, this isn't about market share or it's not about revenue. It's just more about how do we keep our community healthy. So if you are interested in helping, I'd first recommend you go to that West Michigan Vaccinate website that's hosted by the health department. And then if you need further suggestions, you're welcome to connect with our communications team, and Pam Reese or Beth Emmett can provide that information, because we're always looking for how do we connect in, do we have advice to reach to certain populations, and if there's advice on how do we do this even better for regular vaccines or other ways that we can ensure that we're keeping people healthy.
What are your thoughts on how things will be in the future once everyone's vaccinated and people are healthy again and we're kind of back to normal as far as wearing masks more regularly in this country, or how are things going to be different?
Well, I don't talk about going back to normal. I want to create a better normal. I think we should not be comfortable with the status quo. We should continue to push. What we've seen in healthcare is that we have leapfrogged over a number of things to make sure we're providing simple services, that we're trying to be more affordable, that we can be more exceptional and consumer centric. So we absolutely have to keep pushing on that regard. I think there'll be more digital type of services. We're all comfortable with that now. And so the digital foundation will be critical. And then I'd say, back to the one size fits all comment I said before, I think it'll be more personalized. Each person is an individual person, different needs and wants, different ways to access it. And so we have to make sure as we have processes that it allows for that individualization, that personalization approach to people, regardless if it's healthcare or something else. As it relates to masks, I think there'll be times where we will probably wear masks, especially if you're sick. I would hope that we've gotten over this muster through, come to work if you're sick sort of thing, that you actually stay home. I think that people will wear masks when they're in a closed setting and they want to make sure that they are staying healthy. I hope that our hand hygiene practices will continue, the importance of that. But I don't think it will be every day that we'll be wearing masks. I think that we'll go back to hugging and maybe handshakes or some fist bumps instead of the elbow bumps. But it may take us some time. I don't know how comfortable people are going to be as they get in large masses and sharing that space, because we've all kind of grown used to being a little distant. But I'm hoping that we can come together.
Yeah. I'm going to share our poll results here. So it looks like 38% of our audience has already had the vaccine. So that's pretty good news. And the 45% are saying yes as soon as I can. 11% are still thinking about it, and 7% are no's. So I think those are interesting statistics. I know I'm feeling better just having more information from someone like yourself as far as what's been happening and how things are rolling out and where you sit with your opinions and everything. It's been really valuable for us to hear. Are there any final thoughts for us as we close out our interview here?
Well, just a couple things related to the concerns. There's been a lot of things out there about the vaccine. Again, there's 14 million people that have received the vaccine in the U.S. and just under 500,000 in the state. There are reactions to the vaccine. Some people, of course, have a sore arm. They may have a fever. They may have a headache. It just varies, and it's hard to tell what you may have. But those go away. It's not going to last forever. And there have been the good research trials. There are statements out there about infertility. When I've talked to our physicians, they have said that it's actually riskier if you're pregnant to get COVID-19 than to get the vaccine. There's a number of things out there. So I would encourage everyone to do the research. I did I read the documents about the vaccine. I did the research. I asked a bunch of questions about the safety and efficacy of it. And so I think it's really important that you take that in your own hands, that you make informed decisions when it's your time to get the vaccine. If you're a proponent of this, I'd say help others, encourage others to get it. If we're going to get to that 91%, it's going to take all of us using our platforms, our influence, our ability to drive somebody to get to the vaccine. It's really important. But we also know that it is an individual choice, and I respect that. And so in closing, I just say advocate for the vaccine, do your research, continue to stay strong and vigilant in those prevention practices, because we still need to do those right now. And I appreciate your questions and the discussion today. Thank you so much for inviting me.
Well, it's been really our pleasure to have you, and we really appreciate your time.